has killed more than 3,400 people in West Africa. A WHO official tells the Associated Press that given the size of the outbreak, quote, we can expect to see more cases in different countries, including in Europe. California Democrat Karen Bass is the ranking member of the House Subcommittee on Africa, Global Health, Global Human Rights, and International Organizations, and she joins me from Los Angeles. Congresswoman, welcome to Bottom Line. Thank you for your time today.
Thanks for having me on.
Congresswoman, what have your constituents been asking you about the Ebola virus? And as a former physician's assistant, how have you been able to use that area of training to assure them that everything that can be done is being done to keep Americans here at home safe?
Well, I'm actually very comfortable giving those reassurances. You know, back in the days when I was a PA, I worked in the nation's largest emergency room here at LA County, and I've seen outbreaks before. This is very frightening, but to tell you the truth, I'm far more concerned about enterovirus. Enterovirus has hit over 500 people, many children, 43 states. The odds of Ebola really becoming a problem in the United States, to me, are next to none, and that is because we have a very good, strong health infrastructure in the United States, and the African countries that have been impacted do not.
Ma'am, let's talk about the enterovirus for just a moment. A lot of parents expressing concern because it's one of those things where, as I mentioned to our health correspondent Shannon Pettypiece the other day, as a parent you tell your kids wash your hands, but hygiene, basic hygiene here is very critical.
Absolutely, it is. And that's why it's so important for parents to recognize the symptoms. And then, you know, there are a category of kids that are far more at risk, and those are kids that already have respiratory problems like asthma. So parents of children with problems like that need to be extra vigilant, and at the sign of any problem, you know, to make sure that the kids are well cared for. But number one, to keep the children at home and don't send them to school.
And Congresswoman, let's go back to Ebola. Today, the Department of Homeland Security, it announced that agents at airports and other ports of entry have begun observing travelers coming into the United States. If a passenger doesn't display obvious initial signs of the disease, how can that screening then be effective?
Well, actually, if the person is not displaying signs, they are not contagious. They are only contagious when they are symptomatic. And so it's very appropriate to have the professionals at the airport looking for people who might be symptomatic.
Ma'am, my colleague Alex Wayne has a story on Bloomberg.com. It says that the hospital bill for Mr. Duncan, the patient who died in Dallas, was about $1,000 an hour. I ask this question respectfully, given the gravity of his passing and the toll that it is taking on his family. Can the U.S. healthcare system handle the enormous costs of treating Ebola, especially for patients who don't have health insurance?
Well, I think that the United States absolutely can, because there are going to be so few cases that come to the United States. If we were worried about a massive outbreak, then yes, we would need to be concerned, but I really do not think that's a concern. I mean, so far you're talking about, what, 3 to 4 cases?
I mentioned a few moments ago that you are the ranking member on the House Subcommittee on Africa. How would you describe America's response to Ebola, and what more needs to be done to prevent a humanitarian and economic catastrophe, not just in West Africa, but perhaps on the entire continent?
Well, actually, I don't believe it will be the entire continent. I mean, we're talking 54 countries. We can take the continental United States and fit it on the continent of Africa 3 times. So we're talking a huge geographic area. But you know what? I'm actually very proud of the United States response. I think we've been leading the world, but we are not the only country that has been involved. But we have sent over, you know, over $100 million. The fact that the president ordered troops over, which I think was really critical. And one thing that's so important for people here to know is that those troops are not there in a military capacity. They are there to build hospitals. Very few of them will come in direct contact with people who have Ebola. And then the president, when he went to the United Nations, called upon the world to really step up. So I absolutely think more needs to be done, but I'm very proud of what the United States has done so far.
Congresswoman, we have about a minute left. The British ambassador to Liberia, which has seen the majority of Ebola fatalities, He told CNN Liberia is in desperate need of someone to take charge to fight against the virus. Is it the responsibility of the United States to take charge?
Well, I don't necessarily think it's the responsibility of the United States, and I have spoken directly with the president of Liberia, so I have not heard her make that request. But it is very hard for us in the United States to conceive of nations that have very little infrastructure, and that is the problem in West Africa. And it's my hope that these economies that had been moving forward, that this won't be such a blow that they actually move into a negative growth.
Democrat Karen Bass, she represents California's 37th congressional district, ranking member of the House Subcommittee on Africa, joining us from Los Angeles. Congresswoman, thank you so much for your time. It's a privilege.
Thank you.